couple of thoughts as we transition to the awards ceremony, and let me just say, this has been enlightening for me this afternoon. I think, what I took from all of our speakers is the sort of sense that there is an opportunity to bring more control over our destiny in the hands of the employers paying the bill. You heard about bringing more and more primary care and chronic care management in-house. You heard about really working to eliminate barriers of access in the Rosen case, which I think is very important. We know that high deductible care reduces utilization, but we don't know how to do it in a way which is actually a positive rather than a negative. And I think you heard some really powerful messages here. I think from John Mackey, you heard the importance of going upstream to the fundamental cause of much of our chronic care malaise, which is the way in which we feed ourselves. And certainly I'm struck by in my travels around the world, the exportation of the American diet to places that you wouldn't suspect, even in the southern Mediterranean with the Mediterranean diet. Their childhood obesity rates are higher even than the US. And I also think, though, that we must be very honest and accurate in the epidemiological measurement of the effects of all of this. And that really is a transition. And not just to say that any of the pilots that we heard or any of the programs we heard this afternoon violate those principles. But it is always really important to look at the total cost of care effects and to look at the, I was always taught about the fallacy of composition, which is that, sure, you can reduce costs for one group of people, but what are the countervailing behaviors of the provider class when that behavior happens in their community? And so total cost of care can go up in a community, but go down for certain people. And so I think we've got to be mindful of public policies and private actions that don't have those perverse effects. And that really brings me to the awards component of our program this afternoon. This is an inaugural program of awards to really celebrate those value players. And in each of the categories I'm going to describe, and by the way, the broad goal is really to promote price and outcome transparency in all aspects of healthcare. It's very consistent with the presentations you've heard this afternoon. The finalists were each given a numerical score by judges, and I'll explain a little bit about that process in a second. In many cases, the scores were very close, so we wanted to recognize the top three scores, and the absolute pinnacle is diamond, gold, and silver. All of these awards recognize the one winner and the finalists, and we will provide certificates later for the diamond, gold, and silver winners. So this inaugural set of awards was really the result of a collaboration between World Congress, the Health Rosetta Institute, and the Validation Institute, who are focused on validating claims providers make about outcomes from certain types of intervention. And this is our opportunity to announce the finalists. I feel a bit like, folks at the Oscars. I'm the only one that knows the winners, which is kind of exciting. The 2018 Health Value Awards, more than 350 healthcare organizations, employers, and individuals were nominated in 13 different categories. And you're going to hear the names quite quickly of many of them. There are sort of different categories. In the honorary categories, Outstanding Benefits Professional 2017, Purchaser or Employer, Outstanding Benefits Broker or Consultant Leadership, Lifetime Achievement, Clinical Care Lifetime Achievement, Health Benefit Innovation, Public Leadership. Candidates could be nominated without submitting applications. So we've got different classes of categories here. The finalists who are in validated categories, and that includes third-party administrators, direct care providers, and product program providers, were required to have their performance calculation methodologies validated by the Validation Institute to be eligible for an award. So once validated, each finalist application is independently reviewed by our panel of nationally prominent judges. If you go to your value program, you can see who those people are, and we thank and celebrate them for their contributions to evaluating some of the good work that has been done. But some of the criteria they're looking for are, quantitative demonstrations of value, testimonials from peers in the industry, scalability of these activities, the durability, whether people have performance guarantees, if that's an applicable criteria, and really how big an impact, how big a deal is this, and how innovative are they. So those are the kinds of criteria that our judges have used. And quite honestly, the World Congress believes that the excellence on display in these firms is indicative of high performance that is readily available right now and deserving of attention in the US healthcare marketplace, showcasing things that actually are working in the market and that can be replicated. And so we feel privileged to facilitate an approach that showcases these organizations based solely on their performance. All right, so I'm going to start with the first of our validated categories, which is third-party administrators. And by the way, the process here, so those of you in the room don't get sort of distracted, is folks are going to come up as their names are announced. They will interact with our team here to have pictures taken. You will probably not be on the cover of New York Times, but you may be celebrated more widely within your community, so just to make you aware of that. So I am going to start with this first category of third-party administrators, which is a validated category, and the two finalists were Continental Benefits and Group Pension Administrators. The gold finalist is Group Pension Administrator, and the diamond winner in this category is Continental Benefits. So. So we'll allow clapping and attaboys as they come up. In the direct care provider category, we had a number of outstanding organizations: the Aravind Eye Institute, Bonati Spine Institute, Health City Cayman Islands, the Integrated Musculoskeletal Care Group, Redirect Health, Wellness for Life, Vera Whole Health, and Surgery Center of Oklahoma. In this category, the silver finalist was Health City Cayman Islands. The gold finalist, just hold your applause to the end, please. Gold finalist was Integrated Musculoskeletal Care, and the diamond winner was the Aravind Eye Hospital. Please join me in. Excellent contributions from all. In the next validated category, this is product and program providers. The finalists were Access HealthNet, the Zero Card, Advanced Medical Pricing, AMPS, Allergy Choices, the FIA Group, or FIA, perhaps it's pronounced, sorry, Quantum, and the category winners. The silver finalist is Quantum Health. The gold finalist is Access HealthNet, and the diamond winner is the Zero Card. Great, thank you all. In the non-validated category, and it's non-validated not because they aren't valid, it's because we don't. You get it? It's because there isn't an outcome measure necessarily associated with it. So in the non-validated category, among small employer groups with those with less than 250 employees, the finalists were Palmer Johnson Power Systems, Redirect Health, and the FI Group. The silver finalist is the Palmer Johnson Power Systems. Gold finalist, Redirect Health, and diamond winner is the FIA Group. FIA, sorry, my apologies. I should have known. I mean, my Latin is bad, sorry. That's, FIA Group, thank you. Well, congratulations to you all. The next non-validated category is mid-sized employer group, 250 to 4,999 employees. Get one more and you're in a different game. And the finalists in this group are CHG Healthcare, the town of Chelmsford, City of Kirkland, Global Trans Enterprises, and Mayfield City Schools. The silver finalist in this category was Global Trans Enterprises, Inc., the gold finalist, City of Kirkland, and the diamond winner, CHG Healthcare. Okay, large employer groups, those who have over 5,000 employees. The finalists in the category were the City of Houston, GlaxoSmithKline, Intel, Metro Nashville Public Schools, and Rosen Hotels and Resorts. And the winners in this category, the silver finalist was Rosen Hotels and Resorts. The gold finalist was Metro Nashville Public Schools, and the diamond winner was Intel Corp's HR benefits teams. Great. In the honorary category, the first being Outstanding Benefits Professional 2018 Purchaser or Employer, the nominees and finalists were David Berg, MD of Redirect Health, Todd Bisping from Caterpillar, David Hoke from Walmart, Adam Russo of the FIA Group, and the silver finalist was Adam Russo of the FIA Group. Gold finalist, Todd Bisping of Caterpillar, and the diamond winner, David J. Hoke from Walmart. In the next honorary category, Outstanding Benefits Broker or Consultant Leadership in a Comedy or Drama. Come on. Cut me some slack. This is an important category. Sorry, I shouldn't diminish it. David Contorno, Lake Norman Benefits. Heidi Caudle, NFP Corporate Services. Nelson Griswold, Agency Growth Mastermind Partnership, Ascend Summit. Scott Haas from USI Insurance Services. Michael Rogers, Axial Benefits Group. Edward Smith from Health Tree Benefits. And Richard Sutton. I have him on my list. It's Richard Sutton Associates. The silver finalist is Scott Haas of USI Insurance Services. Gold finalist Don Ryman from Echelon. And the diamond winner is Richard Sutton of R.E. Sutton and Associates, in division of Brown and Brown Company. For the lifetime achievement categories, we have provided a description for context in the brochure so that you can see these individuals, and there's more of a write-up. But I would say, having been an admirer of these three finalists, remarkable contributions each of them have made. John Wenberg, Jack Wenberg, as you know, the creator really of the Dartmouth Atlas, probably the first set time in health policy anywhere in the world. I mean, I was a geography major who fell into healthcare, and I remember meeting Jack Wenberg 30-odd years ago as somebody who had pioneered small area analysis. Dr. Devi Shetty of Narayana Health and also the Health City of Cayman Islands has been a pioneer in the delivery of high-value care, both in India and here in the US and in the Cayman Islands, and somebody who inspires all of us who think about disruptive innovation. And John Noseworthy of the Mayo Clinic, a good friend of the World Congress and a great leader in healthcare, has made tremendous contributions for both high diagnostic accuracy and treatment based on their centers of excellence models in the US. So the results in this category of lifetime achievement for clinical care, the silver finalist was John Noseworthy, MD of the Mayo Clinic. The gold finalist, Dr. Devi Shetty from Narayana, and the diamond winner, John Wenberg, MD from the Dartmouth Atlas. So an amazing group of contributors to the health system. In the honorary category, Lifetime Achievement Health Benefits Innovation, the finalists were Barbara Barrett of Langdale Industries, who focused primarily on benefit innovation associated with reference-based pricing and high-performance design, employer mobilization. That was Barbara's sort of areas of recognition. Larry Merlo of CVS Drugstores for health promotion, eliminating all tobacco products from their stores. CVS obviously greatly in the news these days. Tom Emmerich, formerly of Walmart, the Edison Health for Benefit Design Innovation and Centers of Excellence work that he was involved in. John Mackey, whom you heard from earlier from Whole Foods, for reducing healthcare costs and inspiring us to deliver high quality of care and eat less cheese, of course. I don't hold it against him. Harris Rosen from Rosen Hotels and Resorts, who, again, you just heard from. And David Hoke at Walmart, particularly recognizing their low-cost generic pharmaceutical pricing program. So, in this category, the silver finalist is Barbara Barrett of Langdale Industries. The gold finalist, David Hoke from Walmart. And the diamond winner, Harris Rosen from Rosen Resorts and Health. Fantastic and only appropriate, Harris, you were here. Thank you, Mr. Rosen, for your leadership in all of this. The next category is Lifetime Achievement Public Leadership. And again, these are distinguished individuals who have made major contributions to American life as well as to the health system. Warren Buffett, CEO of Berkshire Hathaway, and was nominated really in this category and became a finalist for publicly pointing out that a significant portion of U.S. health spending, some perhaps 5% of GDP, delivers little or no value, threatening both the U.S. economy and its competitiveness while delivering below average health outcomes. So that was the genesis of Warren Buffett's appointment as a finalist. Atul Gawande, one of the great thinkers, writers, leaders in healthcare in this country, made many contributions as both writer, policy analyst, and surgeon, but for really his describing and offering solutions to a wide range of important healthcare problems, from management of high-cost chronic patients to the use of checklists, to managing quality and safety and more compassionate end-of-life care. If you are not familiar with Atul's writings, I would urge you to do that. The great Harris Rosen and the work he has done that we have celebrated a couple of ways this afternoon. And Dr. Devi Shetty, again from Narayana, who we'd hoped to have here at the meeting before family medical situation intervened. And last but not least, Leah Binder of the Leapfrog Group for establishing a credible methodology and tool for consumers to evaluate hospital inpatient quality and performance and medical safety, maternal care, infection and injuries, really is a means to help employers in particular hold health systems accountable. So the results in this honorary category, the silver finalist is Leah Binder from CEO of Leapfrog. The gold finalist, is Dr. Devi Shetty. And the diamond winner is Harris Rosen Resorts and Hotels. Fantastic. Only fitting, given our extreme interest in the work that you've done at Rosen. We moved through this relatively swiftly, and there's one great thing about that, which is you don't want to be, as a Scotsman, the only thing that's standing between you and the bar. Okay. So we will be able to move forward in a second. Let me just explain, though, what is anticipated with these awards on a go-forward basis. And let me first of all just ask that we give a very real and heartfelt round of applause to all of the nominees and winners this afternoon. Thank you. Thank you for all of you, what you have done, excuse me, for American healthcare. Now, what I would like to point out, excuse me, a frog in the throat, is the categories for 2019. So get your thinking caps on, those of you in the field, because the World Congress would very much like to hear your views on these categories for 2019 in terms of the information to be presented this time next year. So this is the way to reach out to World Congress, hva@worldcongress.com. I won't read them all, but I will just highlight perhaps a couple of these categories. And again, because of the methodology used, these will be both in validated and non-validated categories, including reinsurers, commercial insurers, TPAs, direct care providers. You can read the non-validated categories primarily in both the employer side and in the lifetime achievement categories. There will be proposed categories around product program providers, reference-based bundle pricers, a very interesting set of developments in the industry. Captive insurance pools, I think, again, is an interesting area of innovation. Second opinion managers, telehealth, case utilization managers, pharmacy benefit managers, healthcare analytics, and so forth. These are all proposed categories to be included in the next round of evaluations. So I would urge any of you who was a diamond winner to be available outside this ballroom so that you can be interviewed by Mabel Young, who is working on a kind of documentation of honoring excuse me, these winners. So if you're a diamond winner, please be outside. And I think we're a little bit ahead of schedule, but that is not a bad thing in terms of making our way to the reception, which will take place at the atrium level, which is, if you recall, 2 levels down, sort of one escalator, then another escalator, starting shortly. Let me just say in closing a couple of things about the importance of these pioneering contributions you've heard about this afternoon. It's my view that America, you may detect a slight accent, I'm a Scottish, Canadian, Californian, right? And I believe firmly that America will forge a uniquely American health system. We are Well, you're not Canadian. I mean, let's just be honest. It's unlikely you're going to do what other countries have done. Even though they work and I'm not saying that every health system's perfect. I mean, every health system in the world sucks in its own unique way, okay? There is no perfect health system. They are all profoundly dysfunctional and are ugly trade-offs in much the way that Dr. Smith pointed out. Canadians do have to wait. They're not streaming over the borders in droves. There are some Canadians who come here, but not a lot. But there are problems with the Canadian system. I'm going to London tomorrow or day after tomorrow, and I can tell you that the front page of the Times of London will have some story about how awful the National Health Service is, even though in many international rankings they do reasonably well. And I'll be in France later on, and the French system consistently rises to the top in terms of its evaluation relative to other countries. It's got nothing to do with the medical care system, though. I've had exposure to the French health system. It's pretty bloody scruffy, I have to tell you. But the reason the French do well in all these measures is they walk, they drink red wine, and they get naked in the summer, right? Nothing will keep your BMI down better than getting naked in the summer. So as we go off to enjoy our evening and enjoy the rest of the program here at the World Congress, as we forge a uniquely American solution, and I do believe this, it will involve much greater use of market principles than exist in other countries around the world. And those market principles will only function, as Adam Smith told us, if there is true competition on the basis of price and quality, and there's transparency about that in the marketplace. Now, is it easy to pull off in a way that is fair and equitable and just? It's difficult. I mean, that's one of the reasons we have a branch of economics called health economics. We do not have a branch of economics called, grocery store economics or dog food economics or sport utility vehicle economics. The conventional economic theory is pretty decent at dealing with those. And so there is market failure in healthcare, as Kenneth Arrow and all of those who followed pointed out. But that doesn't mean we cannot strive for greater use of transparency, of competition, and of true price transparency in the American health system. And I salute all of you who have been advocates of that. We go celebrate now. I urge you to enjoy the reception and partake of all of the wonderful tracks available here at the Congress. And thank you very much for your attention and your participation this afternoon.